Touch and body work are emotionally laden subjects, and for this reason, open discussion and examination of the issues involved are often avoided. What actually happens when manual practitioners touch their patients? If we ask people the question, are they manipulating bodies or persons? Most of them will answer bodies, because this seems obvious. To say that practitioners are manipulating persons perhaps implies that they are in some way altering patients' psychological processes, and that might seem unreasonable. On the other hand, can we really separate people from their bodies? Can you separate from your body? It's important when you take care of patients to use an expressive, thoughtful kind of touch. And it can be with any kind of aspect of the exam. When you are examining a patient, you are trying to find information. You're listening. You're listening with your hands, your eyes, your ears, and you're getting feedback from that patient continuously. We're not just treating bodies, we're treating persons. And I believe that to have an embodied view of what we're doing is a part of the art of the practice of medicine. One of the important skills to develop when you are palpating is to have both hands touching and interacting. So you can feel the connection between things. You let your hands talk to each other. Put a movement into the body and then feel what happens with the other hand, as if you're conveying the force through the body, and whether or not it's smooth and fluid or not. And that's a big part of musculoskeletal examination and treatment. Another aspect of using the other hand when auscultating with a stethoscope is to use the second hand as a comforting hand on the shoulder. It's also comforting to the child because they know where your hands are. If they are threatened or feel uncomfortable with being touched or have adverse experiences, then you're conveying a different kind of touch that is distinctly different than what they've experienced before. It's a message that imparts comfort, care, safety, and the context of the experience for that child can make a huge difference in their ability to heal. And that's one way you can develop an environment in your office that is conducive to them feeling safe. That's what I've done with my office. I try to make it feel safe, not only just for the child patient, but so often a parent will bring one child but have other siblings with them. So I have this other area in my office for the siblings, which is next to the treatment room. And that then helps the family feel more at ease. One of the important ways of interacting with a child of any age when the parent is there, which they usually are, is to use your skill as a communicator to let that child know that you are really listening to them and paying attention to them, looking at them, talking to them. And if a parent is very intrusive, then you learn tactful ways of helping that parent step back and let you and that child have that interaction. It's very possible to significantly improve your palpatory skills by practicing and being mindful about the way you use your hands. When you're mindful, you remember things in greater detail and in greater context. And to be artful and skillful and to strive for mastery in your work is something that never gets dull, tiring, or boring. And I've learned over 30 years of practice that my sense of touch can continue to grow and develop, and the repertoire I have now in my own mind, my experience of touch, is part of my diagnostic skill, because I know what things feel like, and I've felt them before. And so as I pay more attention to how I do what I do when I'm interacting with the patient, touching them, moving their body, listening to their body, I have this vast collection of experience. So it makes being in practice for 30 years still every bit as interesting and actually a lot more fun than it was when I started. Another aspect of connecting touch is how you use attention and intention, so that the child knows very specifically that you are paying attention to them and that you have the intention of helping them. When you have that in your own consciousness, it's conveyed to the child. You don't have to say it out loud, you're just doing it, you're being that. Achievement in manual therapy is not so much important as attunement. These two words are subtly different. When you're attuning, then you're conveying a lot of connection, a lot of awareness, and you're listening, and that is most of what makes manual therapy effective. If you're trying to achieve something and move body parts around, you're wasting the child's time. Your attunement, your attention, and your focus is very important, because you have to listen to the body to find out how it needs to be changed so that it can function more normally. When you're connecting your consciousness with your hands and your awareness, it's not hard to treat children if they're aware that you're paying attention to them and they feel safe. When you go back to your office this week, I want you to look around as if you were seeing it from the point of view of the child. Ask yourself, is this context a safe place? Does it feel comforting? Is it scary? Is it warm? Is it something that a child would feel safe in and cared for? Take notice of how that might feel to the patient.